Blume edit. The Blume edit. The Blume edit. The Blume edit. The Blume edit.
You're listening to The Blume Edit, where we talk all things beauty, business, and being unfiltered. I'm your host, Kia, from Blume Aesthetics. Today's guest is a powerhouse in the field of plastic surgery, from his medical training in the UK to his advanced fellowships across Europe. And now serving as a specialist plastic and reconstructive surgeon in Perth, he brings a wealth of experience and insight. Dr. Matt Jones, welcome to the Blume Edit.
Thank you for having me. It's great to be here to meet you and your team. So thanks very
For
much.
your first podcast?
My first podcast.
Have you been on camera before?
I have been in Operation Ouch a couple of times when I worked in the UK,
In theatre.
Children's Hospital in the UK.
Yeah. Were you at the Children's Hospital here when they came in and did the documentary?
I wasn't
filming?
actually, no.
That was cool.
Yeah.
That was cool, yeah. Into theatre, and I was in a cranny for that, doing an excision of tumour. That was pretty cool. Well, I want to start with this, with you. Yeah. What is the most misunderstood thing about plastic surgery right now?
The problem we have as plastic surgeons that the consumer or the patients, don't know what a plastic surgeon is. The general public probably feel that it is a surgeon that just operates in the cosmetic space. Now, don't get me wrong, that is a space that we are passionate about and love to operate in, but there is a whole myriad of other areas of plastic surgery that we perform. So in my particular case, I do a lot of congenital hand surgery at the Children's Hospital, but a lot of plastic surgeons operate in burn surgery, hand surgery per se, breast reconstruction surgery. So trying to get the message of what we do, not just being in cosmetic surgery, but the reconstructive side is quite difficult. I don't think the general public kind of know that. The title of specialist plastic surgeon has recently become, because unfortunately, some surgeons have been able to just call themselves a surgeon and also a plastic surgeon or cosmetic surgeon. I think Australian Society of Plastic Surgeons have tried to champion kind of that title just being registered with us specifically. Now, don't get me wrong, there are other surgeons that work in the cosmetic space that are well trained and will deliver excellent cosmetic results.
But they haven't had the same studies as you.
But they haven't had the same studies as us. And generally, to be trained to become a plastic surgeon is about 10 to 15 years of training after your medical school training. And certainly for me, that's kind of the length of time it's taken, including my fellowships when I was abroad in Europe and in the UK. So there's a lot of training that goes around it, and we try to make sure that the patients and the consumers know that we're well trained. We are passionate about cosmetic surgery, but we also are passionate about these other areas of surgery that we perform.
And like you said, I think people don't really understand that you don't just work privately. Like you have a public job where you go and do surgeries for unwell people who have had trauma, things like that.
Cancer surgery, things like that. I think doing this kind of podcast is good because it will help your listeners realise that we are, as plastic surgeons, passionate about cosmetic surgery, but as you say, about 50-50 of my work is private, and then working at the Children's Hospital and other adult hospitals, and there are other patients that have other needs. Principles and techniques that we use in cosmetic surgery, we apply to treating those patients as well.
So just at the Children's Hospital, you specialise in hands? That's what you were saying? What about adults? What do you, for public?
Mainly hands but also skin sarcoma reconstruction as well. So if patients are diagnosed with sarcoma, then I'll help to...
You don't do that in children, or children don't really get...
Yeah, they do, but a lot more rarely. Yeah. It's a rare cancer anyway, but in children it's even rarer.
Do you ever find patients coming in requesting surgeries that they don't need, that you would never recommend for them?
In public, no, because most of the time they have either something wrong with them that needs fixing. So if it's a cancer, obviously, they've been diagnosed with cancer, then we need to manage the cancer. If a child's born without a thumb, which some children are, then we need to give them a thumb reconstruction to help them, their hand function, and help them get through life. So most of the time in public, and that's why reconstructive surgery is different to cosmetic surgery, because in reconstructive surgery you're trying to make a new normal, Whereas most patients who have cosmetic concerns, they generally have normal functioning, facial features or nasal features, but you're just trying to improve their external features as well. So what I'm trying to say is that generally people who require reconstructive surgery,
They require
it, whereas cosmetic patients are a little bit different in the sense that they generally do have
just want it.
normal features. Yeah.
Have you ever said no to a private?
Well, I have had patients where I think their expectations of what they would like to achieve is probably different to what I think they can achieve. So I think, for an example, I remember there was a young lad who had kind of African descent, had a low, broad, flat nose. His projection of his tip was under-projected. It was over-rotated. And he came in kind of asking to look like Henry Cavill from Superman, so the English actor. And like for a lot of surgeons, that would alarm them, I think. But for me, I kind of was like, I want to see where he wants to go with this, in the sense that maybe he just doesn't know what is achievable. I don't suddenly just think, oh, he's got body dysmorphic disorder because he's shown me a picture of Henry Cavill. But we'll go through the motions of seeing what he would like and what I think he can then achieve. So I think in that instance, I did say no to him in the end, because basically his expectations and what I could achieve were different. But I won't just sit there and go, oh God, this guy's crazy. I'll show him a morph of what I think we can achieve, and if that's acceptable to him, it's not Henry Cavill's nose, but if it's acceptable to him, then we'll still go. I don't get too scared about when patients do that, but as long as we're on the journey, and we meet at least twice, that's what we have to do from a legal perspective. And at the end of those consultations, if we're on a path where we both feel like we're going to get to where we want to go, then I'll do the surgery.
I think that's probably the hardest part of non-surgical cosmetics that I do is patient expectations. Yeah. So we get people coming in, like you said, with photos, things like that, wanting to achieve something that's essentially unrealistic. And I think that's what makes a good practitioner, is to be able to assess and decide if that's something that you can do or not.
Absolutely, yeah.
Because you're going to set that person up for failure if you say yes and you can't achieve it, and yourself for failure. I guess.
Yeah. But no one wants complications and unhappy patients, basically.
So what's something that you wish everyone would consider before booking in a cosmetic procedure, or at least a consult with you? Yeah,
so I think research is important across the board, and that's research about yourself. So looking deep inside yourself and saying, what do I want to achieve from the surgeon or that is going to perform the surgery. So when it comes to noses, I want to know 3 things that exactly you want to achieve, whether it's lowering your bridge, narrowing your tip, giving yourself more tip projection. You need to kind of research it yourself and sit down with yourself and go, right, exactly what do I want from this journey that we're going on, kind of thing. So researching yourself, I think, is really important. I think researching your surgeon is extremely important, and that's sometimes tricky to do, but most plastic surgeons that offer facial plastic surgery in Australia are part of ASAPS, the Australian Society of Aesthetic Plastic Surgeons. So making sure that they've got those affiliations with those kind of major bodies, I think it's really important for patients to look up. If you're looking at kind of going abroad as well, which I'm not really against. I've trained in Turkey. I think there are excellent surgeons in Turkey, but you need to be dead sure, exactly where you're going and what those results are going to be. So I think for patients need to do as much research as they can. And then it's about seeing that person, definitely seeing another person as well, because it is a major decision in your life to have cosmetic facial surgery, and just seeing who works best for you and on the relationship. I think I'm big on relationships when I see patients, because I think you're going down major surgery.
It's a lot of trust.
And if I don't trust someone, I don't do it. And same for the patient as well. If they don't trust the surgeon they're seeing, then don't go and have the surgery.
Yeah. So leading on from that, Turkey is obviously like a hot spot now. So Turkey, Thailand, things like that for surgery. So you wouldn't be opposed to someone going to Turkey for surgery, but would there be sort of cautions you would give people?
Yeah, I think it applies to whether you're having surgery in Perth or whether you're having surgery in Turkey. It's the same principles that apply in my head. You just need to be researching the person that you're, going for the surgery with really thoroughly. And if it's in Turkey, there are some excellent surgeons there, and I'd be a massive advocate for people going to have a nose job there if they wanted to, But it needs to be the people that I know that are going to do good results.
I think something for myself I've actually looked into surgeries in Turkey for myself. The main reason being, so I've obviously got a network of surgeons here in Perth. I trust the surgeons here for everything. Yeah. But like I said to you before, being my age and being my expectations of, say, a facelift, I probably wouldn't get a plastic surgeon here in Perth that would do a facelift on me. I think most surgeons say like minimum of 40-year-olds. Is that right?
Well, I think when it comes to facial aging that require surgical manipulation, you're probably not going to get the changes that we can surgically manipulate prior to 40. Okay, so yes, at 40 there are going to be some changes there. You're going to get some loosening of the platysma. So you might get some loss of your cervical-mental angle, so some loss of definition there. You might start to get some jowling, at the lower face, but nothing really before 40. I don't think that there'd be anything surgically that any sane surgeon would go, we can improve that, if you know what I mean.
I guess that's where the line gets crossed, because there are Turkish surgeons who will do that. Like I've seen it for people younger than me, probably less aging signs on their face, have gone and had it done.
But it's interesting because, Botox is a classic example, isn't it, where people were probably doing it, whilst the horse had bolted, so to speak, in the sense that, and then preventative Botox came out and everyone was going, oh, it's a bit crazy. But I think that actually is now standard.
Pretty normal.
Yeah. So, I'm not saying against preventative facelift surgery. It's just probably something that hasn't taken off here, I'd say. Maybe that will change over the next 5 or 10 years, who knows, but I think that's a concept that you could easily apply.
I always say to patients of mine that are considering going places like Turkey, if you can afford to have your surgery in Turkey and then have to pay for any complications that may arise here in Perth, and go for it. If you're scraping the bottom of the barrel to have that surgery done overseas, don't do it. Like I've heard people come back after having breast implants, essentially, borderline septic, needing to have the implants removed, and they're having to pay for all that, probably reinsertion, things like that. If you can afford to pay for all that, then that's fine.
And I think post-op care is really important. As I said, the whole journey for me is from start to finish: the consultation, the operating, and then the post-op care. And I think everyone has surgical complications, right? And being able to monitor them post-op, so making sure people get through to the end where they're actually happy if they've had a complication, say, I think is a big thing. As you say, if you are travelling to somewhere like Turkey, the post-op follow-up is probably quite poor because you're not there. It might be the odd photo, it might, but it's not the same as being as on site in the clinic and seeing how we can address it and get you to the stage where you're happy.
On that topic, have you had any memorable complications post-surgery?
Recently, I did a facelift a couple of months ago, and she had got 2 complications actually, which was frustrating. One was from the TCA peel that I did for the perioral area. She got a little infection or slow to heal in one of her areas here, and required some essentially burns dressing. They call it duoderm, but it was able to lift off the slough, and it healed within 10 days. But it was just a red mark that she could see for about 6 weeks. Obviously she didn't like that because it was on the face. And then in the same sitting, she was a revision facelift. So again, having the conversation, ironically, she had this. Her original surgeon was a guy called Lucian Eon, who I trained with in London as a fellow. So, you know, we kind of laughed about the continuity of care there, but her original surgery was done by him 15 years ago. So she's a revision facelift, always more risky, potential for skin necrosis, and she had basically skin delayed healing here. But it was really lucky because it was kind of not visible from the front, as in, and she, again, duoderm dressing kind of settled that to the point. But it was another wound that took 6 weeks. So those 2 wounds were frustratingly slow to heal. But thankfully, she was very, you know, good about it. And, you know, I think you just got to just make sure you handhold and make sure the things are going to settle.
Something that I've had someone tell me once, having complications isn't make or break for you as a practitioner. It's how you manage the aftermath. Yeah. So it's, you know, if you're in denial, that's not going to help anybody. If you're not being helpful, if, you know, it's how you manage those complications is what, you know, what makes you a good practitioner.
I think so. And people trust you more when you're open about things. And, you know, as long as you can get them to the point where they're happy, which she now is, but it's just taken longer than standard. Yeah.
Are there any procedures that you feel are underestimated in the industry?
We were talking about this at Journal Club just a couple of nights ago. Plastic surgeons, we have a Journal Club once a month, and the trainees present papers, and this month was on facial aesthetics, and one of the, I think, the underestimated or overestimated, I'd say, surgeries is endoscopic brow lifting. I saw a lot of it in London, and I was not like happy with the post-op results because I just don't think they
not dramatic enough.
And we were talking about, there's a guy called a surgeon from Milan, Pascal. I've forgotten his second name now, but he does a lot of a slightly different technique to things. But with eyebrow aesthetics, it's quite interesting because the aesthetics I think have changed over time, and the girls from Milan are obviously liking this kind of like swept back, fox eye, swept kind of lateral eyebrow kind of look, and his technique addresses that. It's actually quite a nice technique, and I'd like to go and see it sometime. Because I don't really, I've never really understood. Another chap I went to see in Brazil, actually, a guy called Fausto Viterbo, he does something called the gliding brow lift, and he addresses the brow in a little bit different in the sense that, you know, I've never understood why from an endoscopic brow lift you'd go onto bone and lift all of the muscle and all of the forehead tissues up, because it's so weighty when the brow is just skin and hair follicles. So he addresses it in a little bit of a different way, where he'll just undermine the skin and reset the brow where you want it through stitches. But it's a tricky area, you know. I think non-surgical, you know, treatments and measures are probably better. You know what I mean?
Longer lasting, I guess,
think
in
so.
terms of long term.
So I think from that perspective, I haven't been super happy with the results of any surgical technique.
To be fair, though, I agree in terms of non-surgical as well. So we have the option of doing thread lifts. PDO thread lifts for the brow. Same sort of a thing, because there's no fat for it to hold on to. It's just bone and muscle. We find it doesn't really last long. You don't get the expectations of the patient are not reached, you know. So that's that same thing of
well, I think that's why tattooing is kind of been, you know, I was chatting to a...
I was going to say, people are shaving the ends of their brows and getting them reshaped up.
So I think that area is definitely, you know, from a surgical perspective, probably overestimated or underestimated.
It's probably quite new as well, is it, being endoscopic? That approach for the face? Or no?
Well, endoscopic brow lift's been around for donkey's years. But as I said, these two other techniques are slightly newer. I think based on the fact that people have just been
more extreme.
Well, no, just not happy with the results that people have done before and the surgical techniques before. So, you know, surgeons like to try and innovate and change things around a bit. But
Well, let's go back to the beginning of your journey. All right. So, what inspired you to pursue a career in plastic and reconstructive surgery?
Well, originally I was going to I started off just trying to do pediatric surgery. And I always knew I wanted to work with my hands. Surgery was I thought it was a good discipline. You needed a bit of knowledge, you need to have good hand skills, and I kind of thought I fitted into that scope. But I like working with children, and I thought I was going to do paediatric surgery. Unfortunately, didn't get on. I think there was like two places in the whole of Australia when I applied, and then things happen for a reason. And then a friend of mine was a service registrar and in plastics, and some of the team there, people that work in it, hardworking, driven, love self-improvement, and I kind of, that was attractive actually at the time, and then things just kind of just ended up going. I actually enjoyed the surgeries that we were doing. Cosmetic surgery at that point wasn't in the forefront of my mind, because there was all these other cool surgeries that you were learning at the time, and then only really came into the cosmetic kind of side of things, or the aesthetic side of things, a little bit later in my training, when I was thinking about what fellowships I was going to do after my training in Australia had finished. And that's when I contacted Enrico Robotti, who's a famous rhinoplasty surgeon in Bergamo in Italy, to see whether I could come and work for him for a bit. And then went from there. But I also pursued my paediatric interests afterwards. That's the great thing about plastic surgery. There's quite a lot of, as we were talking before, there's a lot of avenues you can go down. And I was lucky enough to work at Great Ormond Street and Alderhay Children's Hospital in the UK, and then managed to get a job back here in paediatrics. So kind of went full circle from that perspective. And then also was able to pursue some of the cosmetic side of things that I enjoyed whilst I was away.
Well, I first met you at, I believe it was Princess Margaret Hospital back then. You were a registrar back then. We moved to the new hospital, and then I think that's when you went to the UK.
Away. Yeah.
And then when you came back, not much had changed with you, but I think you came back into a consultant position.
Job, yeah.
So that's you, when you're in the UK, that's when you did the fellowship. Yeah. And then you managed to come back into a consultancy position. Did you find that kind of leadership change make any kind of impact on you and how you practice, or like, do you delegate more? Do you?
Yeah, I think you do. I think going away was a real improvement in your character, and seeing how people do other things elsewhere, because you get trained very well here in Australia and in Perth, but it was nice to go and see how other people do things, where it comes to surgical principles and operations, just to get a fresh perspective on life, and plastic surgery life and how people do it. Coming back here, when I first started at Perth Children's, it was a bit daunting, because you're then the sole person, that's running, your lists and things like that. But I have to say there were some, great supervisors like Lewis Blennerhassett, who was the consultant I took over from. He's always been a mentor from me, and he kind of transitioned for a year just to make sure that everything went smoothly, and gave us tips and tricks about things to do. Or if this happens, do this, But yeah, it's been good, and working at the Children's Hospital's been great from a public career, yeah.
And when you came back, you had a good nurse manager to kick you up the butt.
Yeah, exactly.
So you trained at the University of Bristol and then moved to Perth in 2008.
Yeah.
What led you to the decision of coming into Perth?
Well, interestingly, at the time, it's a long time ago now, but in the UK at that point, there was a bit of a tradition for junior doctors just to go to Australia. I'd never been to Australia. Travelled quite a bit to other places, but never been to Oz. And at that time, there was a lot, and still today, there's a lot of junior doctors that kind of make a bit of a travel, working holiday kind of thing. And that was essentially what it was in my mind at the time. It was just going to be a year or two, travelling and working with the plan to go back to the UK. But there were a couple of things at the time in the UK that really frustrated me. Surgical working hours had dropped to 40 hours a week because of the European Working Directive. And things like that. I wasn't quite sure how that would work with your training, and how good you'd be at the end. And certainly coming here, it was totally different, and they don't kind of are dictated by that. And I think you probably are better surgeons if you are working longer hours for a shorter period of time. More experience, yeah. But yeah, that was the plan. It was just meant to be a working holiday. Perth per se, a friend of mine, we were in a London pub, and his mate had just come back from Perth, and he was like, yeah, it's a great place. It's like lots of beaches, good weather. And we thought, yeah, let's go there, yeah.
So you have a pretty diverse range of specialties that you do, right? So you've got your hands, you've got facial aesthetics, things like that. How do you balance the two different? Do you find it interesting, or I guess like it mixes things up, the fact that you go from one to the other?
Yeah, I think if someone heard, oh, he's a facial surgeon and also a hand surgeon, they'd be like, well, it's completely different parts of the body, and it might put people off. But I have to say, when it comes to hand surgery and face surgery, I think it's very similar. You know, the anatomy is complex, so you need to know your anatomy pretty well in the hand and also the face, obviously. The way you handle the tissues, which is not just a hand and face surgery kind of thing, it's a plastic surgery kind of thing, I think. We're extremely delicate with the tissues, both in the hand and face. You know, I think my old mantra is things that function well usually look good, and things that look good function well, and that applies to the hand and the face. So yeah, I think a lot, you know, operating on the hand, you know, small child's hand that's
little
like
vessels,
little vessels, very delicate.
Yeah.
You know, you apply those same principles to the nose or the face, really. So I don't find the transition difficult.
There's a pretty well-known plastic surgeon in Perth who does a lot of like breast surgery that a lot of our clients go to, and they're pretty surprised to know that he also does things like orthodontic surgery at the Children's Hospital. You know, they kind of think that he does breasts, that's what he's great at, but like, how can he be so diverse? But you know, you don't just specialize in one little thing. Like, it's surgery. You know,
and I have to say, we don't specialize in all of the disciplines of plastic surgery. You know, but there's a few. And
so rhinoplasties are probably one of the most complex procedures, would you say?
Well, it's interesting. You know, it's one of the reasons why I looked to do a fellowship in it when I was training, because I like to be challenged. You know, someone says to me it's the hardest operation, I'm like, okay, let's find out, kind of thing. And you know, going through the training when I was away, I was taught by different kind of approaches, and every nose is different. So a nose job, you know, it's a blanket term for a whole myriad of presentations and how to approach and how to, you know, fix those noses or make them look better or whatever. You know, having that different perspective early on and gaining a whole variety of skills in how to approach a nose is quite good, actually. Is it the hardest thing? Well, if you speak to one person, they'll say yes. Like Enrico Robotti was like, he'd say it would be the hardest operation. You speak to Tim and Dogan in Turkey, and he says it's the easiest operation ever, you know, and the way he does it does look pretty easy. But people have their different takes on things. But certainly when I was training, I was told it was the hardest operation, and that made me interested in it in the first place. But then, you know, going into learning about it, there are some noses that are harder than others, and some noses that are easier than others. Yeah.
Procedures like the high definition liposculpture is gaining quite a bit of popularity at the moment. Can you explain what sets this technique apart from others? So
interestingly, I was away in Europe, and a guy called Alfredo Hoyos, who's a plastic surgeon from Colombia, was the guy who's championed this kind of technique, and he was doing the first course. I was doing a little bit, during my aesthetics fellowship in Harley Street in London, they were doing lipo with Vaser, and I hadn't come across Vaser before in my training, or very little, when I was in Perth. So they were using Vaser, which is ultrasound assisted liposuction. This plastic surgeon, Alfredo Hoyos, has taken it to another level where he uses Vaser to kind of perform high definition liposculpture, he calls it. And Vaser's good because traditional lipo just deals with the deep layer of fat, whereas which is fine for standard liposuction if people want to just have a reduction in their kind of rolls, or it's easy to suction that out with power assisted liposuction. But if you want to do high definition lipo, you have to use something like Vaser, because it essentially liquefies the superficial layer of fat above the deep layer.
Does it heat it? Is it how it works?
Basically, yeah. So you need to, it does heat it a bit, and there are some, again, complications potential with it. In the right hands, it's the only way you can achieve the high definition kind of results that Alfredo Hoyos kind of produces. So, interestingly here, it's obviously taken off in South America for a long time, because he's been doing it for 20 years. America now, and then Europe, but I actually haven't had so much interest in the Perth area. Maybe because we live an outdoor lifestyle, and people are pretty fit and healthy anyway. But yeah, the only way you can do it is using something like Vaser to get rid of that really fibrous, stubborn fat. Because as you imagine, you're trying to sculpt and show off the musculature underneath. So. To highlight that's the only way you can do that.
I think people don't realise that there's different layers of fat.
Yeah.
The deeper fat layers. So you're sort of saying it's the more superficial fat that creates the...
Well, it's more the deep fat that creates the, and that's the easy fat to remove. So standard liposuction, if you just want to reduce your tummy fat, say, is power-assisted liposuction is good at removing that layer. But if you want to take it to the next level where you actually want to see the definition underneath the skin, then Vaser and with power-assisted liposuction is the only way to do it.
What trends do you foresee shaping the future of plastics and recon surgery?
From a reconstructive side of things, I think there are children born with these things, with pathologies called lymphatic malformations, and they have quite large limbs because their lymphatics have been formed poorly, in utero. There's guys championing small lymphatic surgery to try and reduce the inflow into these things, to reduce the size of the limbs. And these guys are coming out of Japan, and they're doing lots of good work on that in the pediatric space. So I think that's something. We tried a couple of cases when I was in Great Ormond Street, based on essentially their presentations and their techniques. So something I've tried to look at trying to introduce here in Perth, but haven't got around to that just yet. But it's something in the pipeline which I think will help, certainly the kids of Perth anyway, if we can get that going. And from a cosmetic side of things, I don't know, you might not like this, but when I was in Brazil, there was a guy, Fausto Viterbo, had about 4 or 5 girls that were wanting essentially permanent Botox, surgical Botox, I'd call it. I hadn't seen it before. And he was doing this small technique where he was kind of like knocking off the nerves to the frontal branch of the forehead and around the eye, as a long-lasting kind of like take on what, the short-acting effect of Botox does.
Long-term, with aging, would that sort of have the opposite effect?
Well, it's interesting, yeah. So, I don't know. No one knows, do they? Because it's so early. Around, but, you'd think surely that's going to be a problem long-term. But
put me out of business, that's for sure. So what do you see in the next 5 years or so being phased out in this world, do you think, in terms of cosmetics and plastics, anything? I don't know, phased out. I think with all these things, there are fashions that come and go. I think fox eye or cat eye surgery certainly hasn't taken off here. It didn't take off in the UK when I was there. There wasn't anyone that was asking for, and maybe it's a cultural thing, I don't know. The States, maybe they would, people want it there, but certainly in the UK and here, I haven't really seen that. Things like extremely large breast implants. Like I know that there's a surgeon here in Perth that is quite renowned for like 1,000 cc's per implant, and I think he's built a bit of a following because of that, in terms of like that's what people want. But I think that's obviously something that's changing a bit. A lot of people getting the implants removed. They're wanting that more natural approach. We sort of try to follow that trend in going for more natural treatments. They're still not non-invasive, but they are following that trend.
A colleague of mine, Adrian Brooks, who does a lot of body and breast work, and a lot of fat grafting actually. It's interesting you talk about breast implants. There has been a push for removal based on something called anaplastic large cell lymphoma, or ALCL, which is essentially a lymphoma cancer that's caused by texturized implants. Now, the rates are reasonably significant, and people have died from it. So obviously, if patients realise that there's a potential for that, that's, it's something I counsel any patient that wants a breast implant surgery, that is a possibility. So you're right, and fat grafting to the breast for a more natural look, if patients have the ability to transfer it, then
you need fat
it's something
to transfer it.
it's something that's obviously more beneficial, I think, than silicone.
And for patients that are wanting to stay educated in like a space full of noise, filters and trending treatments, like what do you recommend? Like what's your sort of...
Instagram is good, but it can also be a curse, I think.
Mm-hmm.
For me personally, Instagram was good when I was away, because one, I was able to get in touch with surgeons that I thought were doing good results. So it is good in that sense. You can platform your results as a surgeon. I think that's a good thing. It's helped educate me when I was away. It's one of the ways I got to see Tia Mandogan in Turkey, was essentially following him via Instagram and seeing his results and the way he does it, and I was like, actually, that's quite good. I like that. But it obviously can be a curse as well. For a patient perspective, looking at Instagram again is an educational thing. If you want results of a surgeon that you're researching, you can see them, and if you like them, then that's great. But there are charlatans on there as well, and people, the amount of times I've seen, there's another eyelid surgeon who I really rate called Cami Parser from LA, who I've been to see. And the amount of times he posts of other people saying it's their results when it's his results is unbelievable. So you're going to get charlatans out there who are pretending to deliver the results that other surgeons are actually delivering. So it's tricky. I think Instagram is a blessing, but also it's a bit of a nightmare.
And here in Australia, we're getting more and more limited to what we're actually allowed to offer on social media. So unfortunately, the people that are doing the wrong thing, their message seems to be getting across. The people that are doing the right thing and not actually posting anything.
Absolutely.
Like you said, it's kind of
win-lose. And unfortunately, from a plastic surgery perspective, the rules and regulations around that have really tightened up in Australia. And you compare it to our colleagues in the United States and our colleagues in the UK and obviously Turkey and places like that. It's a different ball game. And I was advocating going abroad, but they do sell themselves better, because their rules and regs are not as tight as they are here, I think, in Australia. So that is something that we are battling with as well.
And so finally, for any young surgeons listening right now who want to follow your path or a similar path, what's the one thing they don't teach you in training that really matters?
Well, I think that I look back at who struggled or didn't get onto training, plastic surgery training, or who struggled in training. I think being a team player for me has been a big part of my career. Helping people out on call. Even now when I work, you work in a team of consultants, whether it's at the Children's Hospital or at the Adult Hospital, and if one of them needs me to take on a major case because they've got this or their family's sick, or something, stuff happens during life. Yeah, you pick it up, and I think the junior staff that haven't got on or have struggled, I think need to take that on board, and that you have to help your colleagues out. And it goes the same way. Hopefully if I have a problem or need help, then someone will help me. I think that's a big factor.
What do you do to blow off steam? You told me the other day that you spent a bit of time in Ibiza. So do you is travel your...
I do. Yeah, I did. Sorry. Yeah, that was a plastic surgeon's 50th, so that was worth going for a week for. I do like to, and it's not blown off steam, but I do like to go and visit other surgeons. That's one of the things I did when I was away on fellowship, and that's great because you get to, I went to Porto, where I went to see Alfredo Hoyos
So working holiday.
Yeah,
hey?
working
All
holiday.
Tax
Exactly.
right off. Yeah.
But you get to see, Turkey. I obviously went to Istanbul. I've been to LA recently, and I was in Brazil last year. So I think that's a really nice way of educating yourself, but also getting to see a place. Yeah.
Well, Dr. Matt Jones, thank you so much for being here and giving us such a grounded, insightful look into the world of aesthetics from a technical side to the very human side of it.
Yeah.
To everyone listening, I hope this episode gave you a deeper appreciation for the complexity behind aesthetic work and reminded you that informed choices always start with education, not trends. Until next time on the Blume Edit. This is the Blume Edit, unfiltered, unscripted and unapologetic. Subscribe now and tune in weekly.